Everyone, this is Dr. Raja Krishnan from SNS College of Physiotherapy. We are now going to see about what is Myasthenia gravis. In the name itself, we can know that the Myasthenia gravis is the weakness of the muscle. The Myasthenia gravis is the autoimmune disease. Autoimmune disease means the own cells of our body which is attacking our own cells. We are now going to see about the definition, pathophysiology, clinical manifestations, diagnosis criteria, treatment options, and the prognosis of this disease. Now, what's meant by myasthenia gravis? Myasthenia gravis is an autoimmune disease which is chronically occurring. It may be a genetic cause or maybe acquired cause. In myasthenia gravis, the neuromuscular junction, which is responsible for the treatment, which is responsible for the transmission of the signals from neurons to the muscle junction, it is not working there properly. If it is a neuromuscular junction, there the acetylcholine receptors are getting activated and the neurons from brain sending signals to the muscles. Neurons from the nerves, the neurons of the brain, which is sending the signals to the muscles to activate it by the acetylcholine, which is a neurotransmitter. If a neurotransmitter is activating, then only signals from the nerves to the muscles are going to work. In this type, there are about 1 lakh people. If there is 1 lakh people, there are about 20 people are getting myasthenia gravis. That's the survey saying. Then in the pathophysiologies, our own antibodies which are attacking our own muscle, the acetylcholine receptors won't get in action to pass the signals from muscle to the next part of the reflex arc. The muscle is the in the last video from pain we already saw about the reflex arc of the body. It's from the receptor organ and it ends in the receptor organ. In this in between place, the nerves are activating and send signal to the brain, and from the brain we are getting a signal to bend our elbow, to walk, to speak, anything. The signal should go to the brain, and the brain perceives the signal and it sends to the responding tracts, like in a descending tract. If it's for a pain, we already saw about lateral spinothalamic tract. For that, each tract is carrying each work. If for coordination, the cerebellum should activate, and there are so many stuff like this. In this myasthenia gravis, the body's own mechanism is against our body, that the acetylcholine is being produced in the neuromuscular junction. In this neuromuscular junction, the acetylcholine is not getting activated, so the main action of the neuromuscular junction is not going to done. In this, if it is a neuromuscular pathophysiology, the neuromuscular junction won't receive the signal from the brain and it won't helps in the muscle activation. In clinical manifestations, what we're going to see is if there is a myasthenia gravis, a patient's coming, then he is having a muscle weakness, like muscle weakness of upper limb, lower limb, or a girdle. They can't able to do a work independently in their last stage of myasthenia gravis. It may be a symptoms of ocular symptom, maybe symptoms of bulbar symptoms. If it is ocular symptoms, the eyelids won't be getting closed. In this ocular symptoms, he is developing a difficulty in eye movements, in closing of the eyes. These causes will occurring in the ocular symptoms. Next, in the bulbar symptoms, he can't able to swallow. He or she can't be able to speak properly. Chewing is be very difficult due to weakened muscles of the oromuscular functions. Then his social interaction, his social interaction may get affected, and this is the main problem of the myasthenia gravis. Then the secondary symptoms are, he may develop a respiratory complication, and his muscles are going to get fatigue, and the other symptoms like there are if he is getting fatigue, he can't be able to walk, or he can't be able to use day-to-day life activities like ADL. Okay, then we are going to see in the next video how the myasthenia gravis is getting diagnosed and how is getting treated, and a case study on this. Okay, thank you. Okay, in the next video, we are going to see about the treatments of the myasthenia gravis, which is a DD-based video. The students are going to perform it, the exercises of the myasthenia gravis. Thank you.